You know, I walked in here 40 years ago, still here. We've done some remodels we can't do anymore. You know, we got no space. So I think moving forward at this time is kind of crucial, maybe to the viability of this hospital and healthcare facility.
Our vision for the future of this organization is that we will really be a model for sustainable healthcare in the region. And not just sustainable healthcare, but also a model for how people should live or can live very sustainably.
It's not just going to be a hospital. It's going to be a facility that offers, you know, a bunch of different services.
If we can do preventative medicine and get that out to the patients, that is #1 priority, it is so much easier to treat a patient because you're not trying to band-aid them or to fix something that's broken. You're trying to avoid them breaking in the first place.
I remember when I first started working here, probably one of the best compliments I've ever got in my career really, is we were the only thing in town, tons of people working out, there's a doctor working out here. He says to me, you know, there's a lot of people working out, he himself was working out, and he says, you know what you're doing here for these people and what they're doing for themselves exercising is more than I as a doctor can ever do for them. He's right, you know, what they're doing to prevent things from happening is bigger than waiting, or a lot better than waiting for things to happen and then doing something about it.
I was diagnosed with high blood pressure in July 1st, I think it was, and I joined the wellness center that same day because my family has a history of strokes. But I still had a stroke in October of that year. They also said that it would have been much more severe if I wasn't in the good shape that I was in.
About 2 months after the accident that I had the surgery for a variety of reasons, I was certainly concerned that maybe I wouldn't be upright. Maybe I would have to have a walker. It didn't turn out that way, and for that I'm grateful to the medical community. And by and large, that in our hospital here in Baldwin.
I just really think, I mean, the big things that we're really outgrowing this place, to really be innovative and do different things and to keep moving in the direction we've already been moving, we really need a different facility. And we already have all those good things going with the rehabilitation, moving smoothly into the fitness center. It gets a little harder if we get that disconnect and we don't have the facility together.
Since I've had health problems, I've been up to the ER twice when I've been down here. And I hate to even think what would happen if they weren't here or what would have happened to me.
I'm told that in terms of my recovery, the fact that I'd used the fitness center for more than a decade was something that made me able to recover for something I might not have had I not been involved there.
And I think the vicinity of the fitness center being so close is that you can closely monitor and watch your patients as they go through rehab. For instance, if I do a total joint replacement and someone's having difficulty with motion, then I'm right there. I get that instantaneous feedback, and we can work with physical therapy at the fitness center and alter things if we need to.
And I think the focus on wellness and prevention is going to be crucial and hopefully where we go into the future.
The space in this building was not designed to provide integrative health care, which is something we're pursuing. So our new facility, when you walk in, will be highly sustainable, highly energy efficient. Everything we do and the care we deliver in this new building will be aimed at helping you live a very healthful and a very sustainable life.
I wouldn't worry about the health center being too fancy, you know. It belongs with the hospital. It doesn't belong in a separate building.
I would say, too, we don't like to think that the quality of the building we deliver service in matters. It shouldn't matter in some ways, but it does matter.
You got to get with the changing times. If someone down the road offers a spa-like environment, you got to play the game and offer it too. But it's not necessarily a game, it's serious because a patient feels better, and I think it has a lot to do with their ability to recover.
The hospital is a charitable organization. What makes that organization sustainable is being able to get donations. And as with any charitable organizations, the community needs to help support it.
I think we all owe it to BAMC and to the hospital organization itself to see it strive and continue to grow.
how did it feel for me to gift? Real happy. I went into tears talking to Alice and stuff, and I'm just glad to do it. I really am. Since I moved here, I always felt that the people of Baldwin have graciously accepted me as one of their own. So this is kind of payback for me. So.
Baldwin has a proud history of being extremely supportive of this healthcare organization. And for that, I'm incredibly grateful. But now's the time we need to look to the future and what we're leaving in this community to our children and our children's children. And we want to leave this community with a great healthcare organization.